Hello and welcome everyone. Thank you for joining us for this webinar that Chatham House is hosting in collaboration with the Syria Campaign, looking at the situation in Idlib in Syria. I am Lina Khatib. I'm the director of the Middle East and North Africa program at Chatham House, and I also lead our work on Syria. Of course, today's event focuses on Idlib in northeast Syria, where we've had on the ground a very tentative ceasefire since March. But the situation is quite critical, especially now with the spread of the coronavirus, bringing with it another wave of sensitivity to the situation on the ground. And to this end, we wanted to have a discussion with the people who are first responders and humanitarian actors who are working diligently to help the population of Idlib and northeast Syria more widely with us here today. And I'm very delighted that they are able to join us from respective locations. We're going to start today with Dr. Munzir Al-Khalil, who is the head of the Idlib Health Directorate. We're also going to hear from Mr. Raed Al-Saleh, who's the director of the Syria Civil Defense, also known as the White Helmets. And we're also going to hear from Ms. Ala Mughrabiye, who is a child protection officer for the Haras Network, working also with children in Syria and the northwest in general. Before we start the discussion, we are going to play a very short film by Ahlam Rashid, who is a humanitarian and community leader in the Atmi camp in northern Idlib.
مرحبا، أنا أحلام رشيد، إحدى النازحات إلى مخيمات أطمة منذ عام 2012. بصراحة نحن كعمال إنسانيين أو كمواطنين مقيمين في المخيمات نحن عندنا تخوف شديد جدا من أن ينتشر هذا المرض في المخيمات. هاي الكارثة الإنسانية قد تحصد آلاف بل مئات آلاف الأرواح. طبعا عندنا نسبة كبيرة أيضا من كبار السن، عندنا نسبة كبيرة من الأطفال، وهذا الشيء بيجعل المخاوف تزداد أكثر وأكثر. بالنسبة للوضع المعيشي، نحن بنعرف أن المخيمات هي تعاني من حالات فقر شديدة جدا نتيجة فقدان فرص العمل. طبعا الخيمة هي في طبيعة الحال عبارة عن قطعة قماش لا تحمي من الفيروس، ولا يمكن أن نسيطر على الأطفال في أن نحتبسهم داخل الخيمة كما هو في المنزل صراحة. إضافة إلى قلة المياه، وأن نحن نسبة كبيرة كتير من النازحين تتجاوز 1,000,000 شخص في المخيم الواحد، وهذا بيؤدي إلى شح شديد جدا في المياه، وخاصة أنه نحن مقبلين على شهر رمضان، أنه نحن مقبلين على فترة صيف، نحتاج المياه بشكل كبير جدا أكثر من الشتاء. عملت أنا لقاء مع مرة في أحد المخيمات عم تقول لي نحن ما عنا أي واسطة حماية، لا عنا كمامات ولا عنا كفوف ولا عنا أدوات معقمة. شو الشيء المتوفر للعمال الإنسانيين؟ بصراحة ما هو متوفر شيء غير بعض المعلومات اللي عم يتم استقبالها من خلال وسائل التواصل الاجتماعي. هاي المعلومات عم يتم العمال عم بيستوعبوها، بيعملوا دورات وبيطلعوا بينشروا الوعي فقط كجلسات توعية فقط في المجتمعات النزوح، يعني في المخيمات أو في البلدات. وكل عامل إنساني هو بحد ذاته يحمل هاجس مخاطر هذا المرض وهذا الفيروس، ويحمل هم أهله وهم بلده أكثر من قبل، ويعمل كل ما بوسعه من أجل أن يحافظ على سلامة الأطفال، سلامة الناس الموجودة في المخيمات. العمال الإنسانيين بيحتاجوا إلى مواد بتساعدهم على الحفاظ على النظافة كالصابون والمعقمات والكفوف والصابون السائل، طبعا وإجراء تحديثات دائمة حول ما حصلوا عليه من تطورات طبية في الدول المتقدمة، ومن أجل أيضا أن يقدموا هذه المعلومات إلى الناس. وكلنا بحاجة إلى أن يعم الاستقرار وتعود الناس إلى بيوتها. هذه المسألة لا يمكن أن نهمل من خلالها أيضا المعتقلين، فلنفكر قليلا في الأشخاص المعتقلين داخل السجون، أي سجون لا أحدد، كل السجون، كيف يمضون أيامهم، كيف يتخوفون مخاطر انتقال هذا الفيروس لا سمح الله في ظل التعذيب والمعاناة. شكرا لكم على هذه الفرصة اللي أتحتوا لي إياها، وأرجو من الله أن يرفع هذا الوباء عن جميع البشرية. شكرا.
So as we heard there, a bit of an overview of the situation on the ground. I think this is a good introduction to the first speaker, Dr. Munzir Al-Khalil. What's the situation on the ground in Idlib? I know it is very difficult for responders, and the capacity of the health sector is probably not adequate, to put it mildly. So would you mind walking us through the context that we're really facing?
Thank you very much to give me this opportunity. Actually, nowadays, Northwest Syria faces the biggest humanitarian catastrophe around the world. The number of IDPs increased sharply last year, with about 1.2 million. 21% from those new IDPs live in camps, while 79% live in other places like schools, governmental buildings, and open areas under the olive tree. The total population is more than 3 million in Idlib. 65% of them are IDPs. Last time, when we started our awareness campaign, many messages response came to us, especially from the camps people, where you are right, we must stay in our tents, but the problem is that we don't have enough food for 2 or 3 weeks. I work daily and I must bring the basic needs to my family. So if I go out, there is a probability that I may be affected. But if I stay in my tent, I will absolutely die due to the lack of food and clean water. On the other hand, the health sector in this area is very weak due to hundreds of attacks by regime and its allies last 9 years. We lost more than 70 health facilities since April 2019 until now. We lost a lot of equipment and medical staff. For instance, we have now in Idlib Governorate just 47 adult ventilators, and those ventilators are almost 100% occupied most of the time. So I can say now we don't have one empty ventilator that is ready to receive corona patients. We have one patient bed for each 1,600 persons, and roughly 600 doctors in all northwest Syria provide services for 4.2 million, and that means 1.4 doctors for each 10,000 people. At the last point, I will speak about the real response on the ground. We as Idlib Health Directorate, part of the task force, which has been started under Health Cluster umbrella since the 3rd of March, we had written the PRB last time, but the problem was this planning was poor in comparison with the PRB in Damascus, as well as there is no clear deadline. So really, we don't know if this planning will be applied before tsunami corona or after that. We even don't know if it will be applied at all. Till now, there is no one hospital ready to receive corona patients. There is no enough PPE for medical staff or enough masks at least. And that will cause more loss for medical staff and long-term harm. There is no referral system ready. There are no community-based isolations ready till now. And that means there are no places for the suspected patients to go or even for confirmed cases. And they will stay with their families and communities in camps. However, we have now promises from our partners in NGOs that 28 community-based isolation will be ready by 20 May. And what happened so far is the arrival of kits for the only one laboratory in North Syria, and total number was 5,900 tests. Also, very weak awareness campaign and some training for infection control related to regular program, not as response for corona. And any other efforts, I'm sorry to say, that the real response is performed by institutions, NGOs, and communities, and it is not related to task force response, at least till now. For instance, last time, we established it as Idlib Health Directorate with White Helmets and other NGOs, Volunteers Against Corona campaign. And during the first week, 72 NGOs and local volunteer groups joined to our campaign. and we aim to reach for 8,500 volunteers next time to support the community distance activities and other activities related to the general response strategy. In conclusion, now we are under real pressure to change our regular programs to respond to Corona and what that means. We were asked to turn the Central Internal Hospital in Idlib city to Corona Hospital, and that will cause saving some Corona patients' lives and the deaths of others with a higher number because of other health problems and the limited number of ventilators and patient bed we have. Now we prepare study use WHO COVID Essential Service Forecasting Tool, COVID ESFT, to estimate the required health system capacity in northwest Syria during the first 6 weeks of an expected outbreak. The research team forecast is based on 3 scenarios and used COVID ESFT tool. Scenario 1 expected that we will face a medium doubling rate every 4 days and a medium attack rate of 20%. The population figure used was about 4,200,000. Scenario 2, which is more closely considered the contest in northwest Syria, expected that we will face a fast doubling rate every 3.2 days and a medium attack rate with 20%. Scenario 3, in the first and second scenario, actually, we focus on the total number of people, but in third scenario, researchers focus on the most vulnerable people, which is the 1.2 million people living in camps. In this scenario, researchers expected a very fast doubling rate every 2.3 days and a medium attack rate of 20%. We forecast that estimated number of cumulative cases, the proportion of severe cases and critical cases during the first 6 weeks of an outbreak from the time the first case is diagnosed in northwest Syria. We compare the results to the number of inpatient beds and ventilators which are available. Scenario 1 predicts that by week 6 of the outbreak, there would be roughly 55,000 cases. Scenario 2 predicts that by week 6, there would be roughly 836,000 cases. Scenario 3 look at the most vulnerable subpopulation, which is the 1.2 million people living in camps. Scenario 3 predicts that by week 3, not 6, there would be approximately about 240,000 cases just in camps. In conclusion, regardless of which scenario will be, the health sector's ability to cover will be between 1 and 4 weeks before losing control. Thank you.
Thank you so much, Dr. Al-Khalil. You paint a very grim situation on the ground, which should be cause for alarm for anyone who hasn't yet thought of the situation as cause for alarm. The numbers you are mentioning in all the scenarios, as you're saying, are not good compared to how fragile the health sector capacity is, and also all the other issues going on. I'm going to now turn to our second speaker, but just before, I need to remind everyone who is with us today, watching or listening, that if you are joining us on Zoom through your computer, that you can see a Q&A function at the bottom of the screen. And you can use that to send your questions in writing, and I will collate the questions and ask them to our esteemed panelists after they finish their interventions. You may start sending the questions now if you wish, but of course we'll answer them after the interventions finish. Next, I'm going to turn to Mr. Raed Al-Saleh, the director of the White Helmets. The White Helmets, I was just looking earlier today, have been disinfecting tents and have been working very diligently on the ground, also in cooperation with the Idlib Health Directorate. So what is the response to COVID-19 by the White Helmets? And for this, I just want to say that Mr. Raed Saleh's comments will be in Arabic, helpfully translated by Mr. Farouk, who is sitting next to him. So over to you.
شكرا جزيلا أول شيء لإتاحة الفرصة للحديث عن فيروس كورونا بهذا الوقت الصعب كثير اللي عم بمر على شمال غرب سوريا.
Thank you very much for making this opportunity available to speak about the response to the COVID-19 in northwest Syria.
لا شك أنه جميع الموجودين بشمال غرب سوريا لديهم تخوفات وهواجس من موضوع وصول الفيروس، وهذا لعدة أسباب، منها عمليات القصف الممنهجي اللي دمرت 70% من القطاع الطبي خلال السنة الماضية.
Definitely all people who live now in northwest Syria have serious concerns. They are afraid that if the COVID-19 spread in the northwest, that will represent a big threat and catastrophe.
يعني نحن بسبب القصف الممنهج اللي عانى منه القطاع الطبي ومراكز الخوذ البيضاء بالسنة الماضية من قبل روسيا والنظام، هي أدت لضعاف القطاع الطبي وأدت إلى ضعاف الوايت هيلمتس، وهذا الشيء أحد الأسباب الرئيسية اللي نحن عم نحكي فيه عن معاناتنا بعدم الاستجابة، بعدم قدرتنا على الاستجابة لأي سيناريو محتمل في المستقبل القريب.
In fact, the systematic and deliberate attacks by the Russian and Syrian forces against the health sector in northwest Syria have actually weakened the capacity of the hospitals, the medical centers, and the White Helmet centers to be able to respond to such threats.
الموضوع الثاني والسبب الثاني الأساسي اللي أنا حاب أحكي فيه بالمشكلة، واللي هو قبل ما أحكي عن استجابتنا وشو نحن عم نقدر نعمل ضمن قدراتنا المتوفرة بين إيدينا، الموضوع الثاني هو البيروقراطية منظمة الصحة العالمية، بيروقراطية الأمم المتحدة اللي هي سبب أساسي بمعاناة الناس اللي موجودين بشمال غرب سوريا حالياً.
A second challenge I would like to speak about before going to talk about the response which we are delivering now is actually the challenge of the bureaucracy of the big UN agencies and the WHO in regards to the emergency response needs currently in Syria.
يعني الدكتور منذر حكى عن التاسك فورس اللي هو تشكل من بداية آذار، ونحن اليوم عم نحكي تجاوزنا 22 نيسان وإلى الآن ما في أي خطوات عملية على الأرض، وهذا الشيء بصراحة بحد ذاته كارثي للسكان الموجودين بهاي المنطقة.
Our colleague Dr. Munder just mentioned the task force which was actually initiated in early March, and now we are approaching the end of April. Until now there is nothing practically delivered by this task force, while our people on the ground are so worried and just waiting.
ونحن بنعرف كلياتنا تغريدة منظمة الصحة العالمية ب 14 الشهر اللي تكلمت انه هو الكورونا فيروس انه هو ما بينتقل عبر البشر، واللي هي كانت احد اسباب الكارثه حول العالم، واللي هي سببت انتقال كثير كبير لهذا الفيروس حول العالم.
We remember the wrong advice, the statement which was posted by the WHO on the 14th of the month, when they said that the virus does not get spread through people, and that actually increased the risks and the probability of the threat.
لذلك أنا هاي الأسباب هي أسباب كارثية، وهي أسباب تحتاج إلى النظر فيها، وبحاجة فعليا الأمم المتحدة لمراجعة آلياتها، وخاصة في التعامل مع المناطق اللي هي عم تتعرض أصلا لكوارث حقيقية. ونحن سمعنا بعض الأرقام عن بعض المناطق في العالم، فعليا هي أرقام كارثية، وهي تحتاج لمراجعة لآليات عمل الأمم المتحدة بمعظم مناطق الكوارث.
So the UN agencies need to reconsider and review their mechanisms and their processes in the delivering their response. We follow the statistics and the numbers of the other areas in conflict zones and the areas which face crisis, and those figures are very alarming. So serious reconsideration is needed to the whole processes and mechanisms used by the UN.
بالنسبة لاستجابتنا كأخوة بيضاء، نحن منذ بدء فعليا انتشار الفيروس حول العالم وبدأ تطلع التحذيرات من عدة دول بموضوع فيروس كورونا، نحن شكلنا خلية عمليات ضمن الوايت هيلمت وحطينا عدة خطط لها علاقة بالتوعية، خطط لها علاقة بعمليات التطهير المنشآت والسطوح العامة.
Concerning our response as white helmets, actually since the beginning of the crisis, when we started receiving the reports about the threat of the coronavirus elsewhere, we established white helmets operations, crisis operations room to prepare our response, and we developed plans with multiple scenarios to focus on the activities of the awareness first and the disinfection of the infected areas.
شكلنا فرق خاصة بالتوعية، شكلنا فرق خاصة بالتطهير، بدأت فعلا العمليات تنتشر بكل شمال غرب سوريا وتستهدف بشكل أساسي المخيمات أيضا.
We formed special teams to deliver awareness campaign on the COVID-19, and also we formed special teams to deliver sterilization materials and disinfection of the hospitals and the schools and the main areas which can be affected.
شكلنا 75 فريق أيضا للبدء بعمليات تطهير واسعة تشمل معظم المنشآت والمخيمات اللي موجودة بشمال غرب سوريا، واستجبنا لأكثر من 7000 منطقة قمنا بتطهيرها بشكل كامل.
75 teams were formed for this purpose, and they delivered more than 7,000 disinfection tasks in multiple areas, including the camps and the areas where people usually gather.
طبعا استهدفنا أكثر من 1000 مخيم، استهدفنا أكثر من 1900 مسجد، أكثر من 1323 مدرسة، أكثر من 507 مركز طبي ومستشفى.
That included more than 1,000 camp, 1,900 mosques, 1,300 schools, 507 health center, and 1,800 other public utility centers.
أضف إلى عمليات التطهير قمنا أيضا بإجراء اجتماعات تنسيقية على مستوى شمال غرب سوريا، وكان مثل ما حكى الدكتور منذر أنه تم إطلاق مبادرة متطوعون من أجل كورونا، بالإضافة إلى إطلاق آلية تنسيق شاملة بكل شمال غرب سوريا لتشمل كل المؤسسات الطبية مع المؤسسات الخدمية والدفاع المدني لحتى يقدر يكون في استجابة متناسقة لكل العمليات اللي عم تصير بشمال غرب سوريا.
In addition, we were engaged in all the local coordination efforts with the Idlib Health Directorate and the other health actors on the ground. We initiated the call for volunteers against Corona to gather many volunteers in different areas to help in this response. And we've been also in close coordination with the other health actors to prepare for a joint response.
وأطلقنا أيضا منصة تدريب للتوعية بكورونا، ودربنا أكثر من 300 متطوع إلى الآن ليقوموا أيضا هن بيقدموا خدمات توعية للمجتمعات، وما زلنا نقوم بعمليات تنسيق وتدريب لمتطوعين جدد بشكل يومي.
We also offered an online training platform to provide training for trainers and awareness staff on the COVID-19. So far, we have trained more than 300 volunteers on this awareness sessions.
وكنا نعمل الآن على تخصيص 25 سيارة إسعاف مع 25 فريق مدرب ليكونوا جاهزين ومستعدين لنقل أي حالات يشتبه بأن كورونا هذا الشيء بيعتبر هو 20% فقط من إمكانياتنا الإسعافية اللي عم نستخدمها بشمال غرب سوريا.
In addition, and in coordination with the Health Directorate, we have allocated 20% of our total capacity of ambulances to dedicate 25 ambulances with their teams to deal specifically with the suspected COVID-19 cases to provide ambulance service and transportation for such cases.
بدأنا أيضاً بتشغيل المعامل اللي هي خاصة بالوايت هيلمتس بشمال غرب سوريا لتصنيع الألبسة الواقعي من الفيروس كورونا، وقريباً جداً راح يكون في بداية انطلاق عمل صناعة الكمامات حتى يكون كل تأمين المنتجات الحماية الشخصية كان للمتطوعين، وإذا قدرنا نأمن الكادر الطبي بشكل ذاتي ويكون تصنيعها داخل سوريا وما نحتاج نستوردها من برا.
In addition, we shifted the focus of our atelier, which usually produce the uniforms for the white helmets. Now we shifted its focus to work on providing protective gears, protective gowns and suits against the virus. And very soon we will launch a production line of masks inside Syria to be able to produce masks and distribute them to the white helmets responders and also to other health facilities.
أيضاً لدينا عدة اختبارات الآن، هي اختبارات إبداعية ولكن كله تحت الاختبار لصناعة معدات وواقيات بالطابعات ثلاثية الأبعاد داخل سوريا لحتى نقدر نخفف من حجم الاحتياج داخل سوريا، ولكن لحتى تنتهي الاختبارات بنقدر نعلن عن هاي الأمور اللي نحن فعلياً حالياً عم نختبرها بسوريا.
In parallel, we have dedicated units working on innovative ideas and products using 3D printers inside Syria to produce the needed materials which are not available or very expensive to import them. We are now in testing phases, and when the products are ready and tested, we will announce them.
Thank you very much.
And thank you.
Thank you very much, both of you. Last but not least, we're going to turn to Ms. Mokrabiye. You work obviously on child protection, and children are likely to not be able to go to school other than other vulnerabilities that they're exposed to. So would you mind telling us a bit about the situation in the Northwest?
So thank you, Lina. I am a child protection officer. I work with Harass Network, the leading NGO in Syria in the field of the child protection. Since its establishment, Harass committed itself to working inside Syria during the worst stages of conflict. We help the most vulnerable children, including those with disabilities, to access education in formal schools and have quality learning opportunities. Harass has integrated a child safeguarding system into 1,400 schools, which has reduced harm over 300,000 children. And we have established a network of 31 local child protection committees in different regions across Syria. Harass also protects children against child recruitment, abusive labor and exploitation, and child marriage. And we work to empowering communities to provide equal opportunities for boys and girls. As my colleagues has implied, the humanitarian situation is deteriorating, and the COVID-19 pandemic raises even more concerns. It's not looking good for the children in Northwest Syria. I wanted to start with the story of Sarah. Sarah is a 13 years old girl who taught Haras the story of her education. Sarah used to go to school when she used to live in Eastern Ghouta, but her school was destroyed by bombs. Then she was displaced to another town and she went to a school which was in a basement. But that was not safe and the school was damaged after another attack. She was displaced again, and after 1 year, Sarah was able to go back to school in Idlib. And she told us that she was very happy that she thought that she's going to envy herself, so she did not tell anybody around her except for Haras. Unfortunately, after a month after Sarah joined the school, the COVID-19 emergency was announced in northwest Syria, and her school was suspended. And now Sarah has to stay at home. Sarah's story is far from unique. After the suspension of schools and education activities due to the conflict, and now COVID-19, 500,000 of children are out of school in northwest Syria. And their chances of going back to school and to their education are getting lower and lower with time. School closures and other consequences of the disease outbreak have a huge negative impact on the learning, safety, and well-being of most vulnerable children in the poorest families. Families can be separated during the outbreak. Children are living in stress, and they are at greater risk of physical violence and neglect. And the financial burden of quarantine measures makes children more likely to be recruited into child labor. Many children suffer from huge psychosocial distress and from the chances they are put through during the emergency. If a child is injured or a family member dies, they are more even likely to be learning less, eating less. This is because of the psychosocial distress from being ill themselves or from the distress of the circumstances they have been. And they are more likely to be subjected to other safeguarding issues. In addition to children making slower progress in their education due to the disruption, the longer that the schools are closed or used as an isolation wards, the harder it's to re-establish the system that maintain engagement between parents, teacher at all. All children are at higher risk of dropping out altogether. So Syrian organization, Haras and other partners are working hard to make sure reaching as many children as possible to maintain their education and child protection in response to the potential outbreak of COVID-19 on northwest Syria. We, and alongside other organizations, have launched a digital learning platforms for Idlib's children that is reaching 187,000 children, including Sarah. It also allows teachers and other school staff to continue their professional development and provide support for children. The digital learning platform includes daily routine for children and their families, and it includes psychosocial support, family consultations, and child protection advice, in addition to literacy and numeracy support. We have found that to have an impact, these education interventions must include aspects of psychosocial support, and they must be linked to a routine or key point in the day. Also, quarantine self-learning kits have been provided for families who cannot access the digital platform, including family living in Idlib camps. In addition to what have been done, health and other civil society responses to COVID-19 must all integrate child protection measures to address these new risks to children of family separation, domestic violence, and child labor, and many others. Critical to child safety is proper housing. We must find enough shelter to house displaced communities, including people in tents. We are trying to protect education facilities from being used as isolation wards so that it's easy for children to return to school as soon as possible. If school must be used for health responses, we want that to have a clear and strict exit strategy for those facilities. There is a risk that if sick people are housed in schools, they won't agree to leave as they don't have other shelter to go to. Internet connection is really important at this time to support the surge in the needs for parents and their children to stay connected and establish a routine, stay informed and connected to have pathway back to schools. We also need to prioritize these stigmatization programs so that those who have been infected with COVID-19 don't become isolated or stigmatized because of the infection. Above all, I believe there is need to have a real investments in smaller organizations that are already operating successfully and which have built relationship of trust with their communities and authorities. Syrian civil societies can produce results during and after an outbreak crisis. Children in northwest Syria have already gone through so much. Prior to coronavirus, 1 million people, and over half of them are children, were displaced from their homes by months of intense shelling. Schools had only just opened after the ceasefire, when the coronavirus has emerged and schools had to shut down again. Harras is working as hard as we can to protect these children and to protect their learning. Thank you.
Thank you, all of you, very much. Now we have around 22 minutes for questions. I actually wanted to start with you, Ala, if you don't mind. If you were to prioritize what international donors in particular should be supporting right now when it comes to the children of Idlib, what would you say they should turn their attention to and resources?
Well, as I mentioned, Lina, their education should not stop. Their education is not for their education, it's also to build their routines and more to protect them more, to stay connected with the child protection actors and teachers, to be more safe and to address those concerns that I talked to. We have to also prioritize the integration of child protection with the other responses of health and civil societies organizations who are responding to the response.
Thank you so much. And you raise a very important point here, which is obviously that very often international donors seem to split the way they conduct their programs and activities by sector. So health is perhaps regarded as being separate from education, education being separate from wider civil society programming. And what you're saying is that there should be cross-sector programming that is more holistic, that the international donors should take a different approach. I think this is a very, very important point. I'm going to ask the same question to Dr. Munzir Al-Khalil. We have questions coming through the Q&A, keep them coming. But let's start with recommendations. You talked about the situation on the ground and how difficult it is, and some of the questions have been about external support. We can go into more details, but let's just start with what you think should be done.
I think the first issue, because we think that the protection of medical staff now in Syria, maybe it is the most important thing, because if we lose now our medical staff, our doctors, we will lose on long term, even after Corona crisis. So the first thing, if we can offer the protection tools for medical staff like PPE and others, training medical staff, increase the number of patient beds and oxygen generator to support the 14% from the patient in general who they need oxygen and other support, and increase the number in on ventilators actually. And others issue, as you mentioned, support other sectors like education, like wash, like shelter, because now actually, because the very bad situation in camps, we actually can't offer a lot as health sectors. Now, the occupancy rate of camps in some places more than 400%. So no way to ask people now to do community distance, no way to ask them to wash their hands for 20 seconds. So as you mentioned, it is very important to think now how we can, as many sectors, respond together to Corona pandemic. Yeah.
Okay, thank you very much. There are a number of questions about the WHO, so I'm going to try to cover this because I think it's very important. I mean, of course, the WHO itself is facing not just criticism from the United States, but funding cuts. One of the concerns, and perhaps this is something that Ra'ed Saleh can also comment on, considering you mentioned the WHO in your comments, but of course, you know, the question is open. Might funding cuts on the WHO have a negative impact on Idlib? But at the same time, I am having comments in the Q&A sent to me with critiques of the WHO, saying that it seems that the WHO is functioning a bit better in regime-controlled areas than it is in Idlib. Why is that, in your opinion? There was a related question to this, which is the promises that the WHO gave regarding support for the Northwest in Syria versus the challenges of delivery, or perhaps just inadequate delivery altogether, especially when it comes to procurement. So it seems that people are quite surprised that the WHO is not as effective as perhaps it might be. So I'd like you to weigh in on how you assess the performance of the WHO. Why is it not delivering in the Northwest as in other places in Syria? I don't know who would like to start.
Ra'ed, please, you can start, and I will speak after you.
هلا انت لا الافضل تحكي عن التمويل انت، بس انا بقول لك انه قطع التمويل عن الدبليو اتش او هو اكيد رح ياثر على عمليات السفر تبعهم، لانه هي 42% ميزانيتهم بتروح للسفر وبس 8% بتروح لشراء المعدات، فاكيد اي قطع بالتمويل هو رح ياثر على السفر تبعهم على دول العالم. واكيد انا دائما يعني انا ما بس بنتقدهم بشده بطريقه عملهم وبتعاطيهم بموضوع شمال غرب سوريا، لانه فعليا هن الى الان ما قادرين يوردوا اي معدات، وهذا الشيء بصراحه برايي فشل لوجستي كثير كبير بالنسبه لمنظمه الصحه العالميه، لانه هي ما استغرق معها وقت كثير كان الوقت قليل لحتى قدرت توصل لدمشق او حتى توصل للقامشلي. واكيد نحن ما لنا ضد انه يوصل هاي المعدات لدمشق والقامشلي، ولكن كان مفترض انه توصل هاي المعدات بشكل متساوي ولكل المحتاجين بسوريا، وهذا الشيء اللي بيحكي عنه القانون الدولي الانساني، وانه كل المحتاجين هن لهم الحق بالوصول للمساعدات الانسانيه الدوليه.
Cutting funding of the WHO might have first impact on their travel budget and meetings budget, because they spend much more on travel and meetings rather than what they allocate to the final products or outputs delivered to the beneficiaries and the vulnerable people on the ground. This is really a key challenge, how the WHO is spending the donations and the funds which it receives. Secondly, we are very concerned that actually the way it delivers the assistance, it's not impartial and not balanced. We see that they prioritize equipment and assistance to the regime-controlled areas. We definitely are not against in any way delivering humanitarian assistance to our people and our brothers and sisters in the regime-controlled areas, but we believe that the assistance should be delivered on needs basis. It should be needs-oriented, and it should be balanced across all the areas who need the assistance in Syria.
واعتقد انا يعني من خلال المعلومات المتوفره عندي ان هناك بعض المدراء بالWHO الاقليميين هن لديهم مصالح سياسيه باتخاذ عده قرارات غير متناسبه مع حجم الاحتياج الموجود داخل سوريا، لكن ما بعرف انا شو هاي الخلفيات، شو هي هاي المصالح السياسيه، لانه إذا كان رئيس المنظمة هو كان يعني عم بيدير باله على المصالح الصينية، فأكيد بيكون في مدراء بالمنطقة بيديروا باله على المصالح الروسية وبيخافوا يتعاطوا معاهم بهاي القضايا.
We have concerns that we suspect that few of the regional managers or senior people in the WHO working on our region have political interest or affiliation supporting the regime's agenda and the Russian agenda, and that won't be surprising, as we heard also doubts about the director of the WHO who was accused of repeating the Chinese statements and propaganda on this. Dr. Munzer, up to you.
Thank you. Thank you very much. Actually, I can say till now that WHO didn't offer $1 to Northwest Syria. By the way, the PRB in Damascus, it's more than $100 million. And till now, WHO and some other partners offer most of the money to Damascus. So there is no real problem according to financing issue in Damascus, and of course, according to equipment. While in Northwest Syria, till now, I can literally say there is no one patient bed ready to receive corona patient. They don't offer one ambulance car to receive corona patient. So there is something we can't understand. More than 2 months now, when we fail, or WHO fail in offer just one patient bed, so there is, I think, there is like real problem. And actually, when we discuss with them many times, okay, we understand that there is a problem. There is a problem in ventilators, for example, because most of the countries now around the world have this logistic problem. But what about other needs? What about oxygen generator? What about patient bed? It is very simple. Patient bed inside Syria, we can offer them. It is very simple issue. So when they fail totally offer anything, so we have to ask it ourselves what's the problem actually. And I think there is negative roles here, because when WHO say many times that we have money to this planning, to this PRP, a lot of donors actually think that we don't need to invest in this place because WHO take the lead here. But the problem that after they said for months that we have resources to respond, now they said that we don't have any kind of response, and you have to turn your regular program to respond to Corona. So to be honest, WHO, of course, they have actually real problem now in Northwest Syria. For us, it's like Google. We can get some awareness brochures from Google. At the same time, we can get some awareness brochures from WHO, not more than Google for us till now. And the problem, the real problem now, that in other countries around the world, there is government take care about the people in this area. But in our situation, our government, Syrian government, attack our health facility and killed our medical staff with Russia and with their allies. So in our context, in Northwest Syria, WHO have to take the lead to respond to Corona, to Corona disease, not like work like Google, just sent to us via email some awareness brochures. So thank you for WHO.
Okay, in that case, I have 2 follow-up questions. One, might there be a solution through Turkey, for example, conducting tests in Turkey instead of in Northwest Syria, if there's lack of capacity, as you're saying? The second question, which may be a bit more controversial, but one of the questions we received is can there ever be coordination between your health directorate in Idlib and the Ministry of Health in Damascus on just the health sector, obviously, and humanitarian issues?
The question for me?
The second question definitely for you, because it's about the health directorate in Idlib. Might there ever be any coordination between yourselves and the Ministry of Health under the regime, obviously, in Damascus, considering that, as you're saying, the WHO seems to be diverting its resources through Damascus, which is basically how the WHO operates when it comes to its interactions with the regime. The regime obviously wants things to pass through its own ministries, but might there ever be any potential to coordinate on the basis that this is just about humanitarian and health issues?
Actually, first of all, we don't trust in Ministry of Health in Damascus or in the government in general, because you know that the same government, the other ministry attacked our hospital and killed our medical staff. And even it's not the first problem we face with the government in Syria. I remember in 2013 when they cut the vaccine for children, so the polio appeared again in northwest Syria and in Syria in general, because even use the vaccine of children as like as guns, as tools to punish the people in this area. And actually, because we have a good relationship with our colleagues, the doctors in Damascus and in different areas, we know that in Syria there are a lot of corona cases before the government published the first cases. According to our colleagues, they work now in hospitals, and we remember like when the Minister of Health in Damascus said that we don't have problem with corona because the Syrian army killed the bacteria in this area. So actually, according to what he said, actually, so really we don't have like, there is no trust, there is no way, because you know that there is no cross-line now point between northwest Syria and between Damascus. And at the end, WHO have to be very clear with us. If they want us to deal with Damascus, with the Ministry of Health, so they cut everything from here and support Damascus, they have to be clear with us that this is our planning. But till now, they face problem with transparency. They don't told us frankly that this is our planning. So at least they must say that this is our planning, and after that we will discuss our solutions and our choices.
Yeah, and my own research on the issue when it comes to the Northeast showed that tests done in the Northeast have to be processed in Damascus, but they're not getting the results back. So even when there is an attempt at some sort of coordination, it's not necessarily leading to good results either. Mr. Raed, if you don't mind me asking you the question about Turkey, might a kind of workaround be to have tests done in Turkey, or perhaps increase help from the Turkish side as a way to get around the inadequate support from the WHO?
حقيقة الجانب التركي موجود أيضا ومنخرط هو ضمن عمليات التنسيق الجاري بشمال غرب سوريا بشكل فعال، وهو تحمل منطقة عفرين ومناطق جرابلس وعزاز والباب، وهو قال أنه سيتحمل مسؤولية هذه المناطق من حيث التحليلات ومن حيث رعاية المصابين بكورونا.
The Turkish side is already involved in the existing coordination mechanisms regarding the COVID-19 response. And we understood from them that they will cover the response activities in the areas of Afrin, Jarablus, and Azaz in northern Syria.
لكن المشكلة الحقيقية هي التي نواجهها اليوم بشمال غرب سوريا هي في إدلب. هي إدلب كون أنه تركيا قالت أنها لن تتدخل في إدلب، وإنما والتاسك فورس الذي شكل من قبل المنظمات الطبية ومنظمة الصحة العالمية قالت بأنها هي من ستتدخل بهذه المنطقة وهي من ستقدم المساعدات لهذه المنطقة. لذلك يعني تركيا قالت أننا لن نستطيع استقبال أي حالات من إدلب، وإنما حالات إدلب سيقوم بتحليلها من قبل مختبر الPCR الموجود في إدلب، وسيكون هناك رعاية للمرضى الموجودين في إدلب ضمن إدلب ولن يخرجوا إلى منطقة أخرى. وحقيقة هذا يعني سيلقي عبء كبير على المنطقة مع تأخر منظمة الصحة العالمية بتقديم أي استجابة ملموسة على الأرض إلى الآن.
The biggest challenge is in Idlib area itself, because the Turkish health facilities does not cover this area, as they allocate their assistance to specific areas, Afrin and Jarablus, as we said. But Idlib is supposed to receive the support from the WHO through the task force, which was formed, as we said, in early March. And so we are in this difficult situation that patients in Idlib, for example, they cannot receive treatment in Turkey, or they cannot be sent to testing centers established by the Turkish side. They are supposed to be sent to the testing center and receive the healthcare as planned with the WHO. But actually, because of the chronic delay, we didn't receive anything yet from them for Idlib.
أضف إلى ذلك أنه تركيا يعني إلى الآن هي تعطي التسهيلات اللوجستية لنقل المعدات إلى سوريا، وما سمعنا عن أي حالة منع إلى الآن بأي نوع من الأنواع أو الاحتياجات الطبية لمستلزمات كورونا إلى داخل سوريا.
However, Turkey so far provides logistic support by facilitation of the movement of materials and equipment needed for the COVID-19 response. So until now, we didn't receive that any shipment of equipment or materials for the COVID response was disallowed or prevented from crossing the borders to Italy.
Okay, thank you so much. I'm gonna ask Ms. Mourabi about Idlib in general. You painted a very grim picture, which is very critical. One of the questions received is, how come Idlib is not a priority for international donors and perhaps for the media in general? You know, I mean, obviously everyone is now very concerned with the COVID-19 crisis, but Idlib obviously is vulnerable. So in your view, why do you think there isn't enough attention to Idlib?
Well, as you said, Lena, this COVID-19, it's a global worldwide pandemic. And I think from my opinion that all the donors are paying attention to their own country responses and paying a priority to their country as a response and holding their monies for the Northwest Syria until they see if actually a positive case got not forbidden that a case could be positive in Syria. So they are waiting and holding the breath until anything comes to the horizon. But until now, only the in progress funds are being operated, but there is no any new funds, and there is no, as you said, there is no attention to Northwest Syria, and they are not paying enough attention to the vulnerabilities in Northwest Syria and the situation of the health and humanitarian response, which need a lot of support to help the people and protect them.
Thank you so much. I think the issue of no new funding is being earmarked is definitely very alarming. On that, unfortunately, not very positive note, we're running out of time, so I need to draw this event to a close. Thank you so much to all our panelists. Thank you to all the people who joined us and to those who asked questions. If there are any journalists who are with us who would like to interview our panelists, you can contact media@thesyriacampaign.org and they'll put you in touch. And join me in virtually thanking our panelists, and till next time. Thank you very much.